All right, so this week we'll be discussing Chapter 2, Ethical and Legal Issues in Psychological Interventions for Children and Adolescents. So, what are ethical issues? When we're talking about ethical issues, they come about when professionals must decide between competing values, responsibilities, or standards of conduct. So think of ethics as that moral compass for our profession. It's the guidelines that'll help us to figure out what's right, what is fair, and what is respectful in our line of work. Unlike laws, which are legally binding and carry consequences such as fines or jail time, ethics are professional standards. Breaking them doesn't land you in court. Well, unless a law has also been broken, then it can lead you in court. But it can result in professional consequences, such as probation, loss of membership, or even losing a license to practice. You have several professional organizations like the American Psychological Association, the American Counseling Association, the National Association for School Psychologists, as well as the National Association for Social Workers. All of these different organizations publish their own set of ethic codes, and it's these documents that are considered essential roadmaps for practice. They don't cover every possible dilemma, but what they do is establish guiding principles for decision making, both in our everyday work as well as when we're dealing with crises. So then the question is, why would we need ethics? Why does it even matter? Well, when you're working with children and adolescents specifically, you're not just dealing with one client. You're more or less balancing the needs of multiple stakeholders in this case, that being a child, their parents, their teachers, school administrators, hospital administrators, supervisors. More or less, what happens is that it creates a unique situation where ethical questions are going to be inevitable. So, some information you have to understand would be like who gets access to confidential information? How much should parents be involved? What happens if a child discloses something dangerous? What does a counselor or therapist do then? Ethical codes will push professionals to pause, to reflect, as well as take time to evaluate the choices so that their actions benefit the client and help them to avoid harm, which is our number one goal. Some of the key ethical principles when we're thinking specifically about child and adolescent counseling would be first, responsibility and client welfare. This is where the child's well-being comes first. As counselors, we act as advocates for the child, ensuring that the interventions will promote safety, growth, as well as an overall quality of life. Secondly, and this is an important one, is confidentiality, because this is the cornerstone of therapy in itself. Confidentiality will build trust. However, here's where it's sticky because we're talking about children. So that makes confidentiality a true complexity because parents or guardians often expect access to the information that a child gives to counselor or therapist. As professionals, we need to be able to explain the limits clearly, such as when safety concerns override confidentiality. Then we have to talk about parent notification as well as involvement, looking at how parents do have legal rights, but the involvement has to be balanced against having the child's autonomy as well as their therapeutic needs, because that's going to always be in question. It takes striking a balance between sensitivity and then sometimes negotiation as well. And again, you want to be upfront with this in the very beginning. Explain this to the parents as you're about to be introduced to the child. Who gets to tell you whether or not It's important to understand that parents have the right to choose therapy or counseling for a minor. However, you want to make sure that a child agrees to it as well, which is basically getting assent. Okay? Assent is where the child might have to sit there and listen, but if you have assent, that means they're agreeing to participate in the process. Next thing we have to think about is professional relationships, that being boundaries. And there has to be boundaries maintained with the student, with the parents, as well as with your colleagues. You have to consider dual relationships, that being that both the child's counselor as well as the family friend may blur professional judgment, and if you can, avoid it. Fifth consideration is competence. Professionals in our field will only provide services when they are trained and qualified to deliver it. This means that you're seeking supervision, you're going to get consultation, and I'll tell you right now, as you become professionals, consult with everything that you can. Make sure you get second opinions, and don't let it always lay on top of your shoulders when you're not 100% sure. This is what we consider ongoing professional development. Then we have to consider public statements as well as presentations. Professionals here are expected to be truthful, to be responsible when they're sharing information, whether this would be within the media, research, or even in training contexts. Misrepresentation often leads the public to mistrusting our profession. So you want to be careful about that. You don't want to harm our credibility as a profession. Then we need to consider the private practice of school issues, which I'm going to talk about a little bit more on the next set of slides. But it's something that we have to take a consideration for. So, in trying to predict and manage ethical dilemmas, Smith in 2003, felt that not all ethical dilemmas can be predicted. However, professionals should take the time to evaluate situations for any kind of potential conflicts, talk about the dilemmas with their colleagues again through consultation, as well as meeting with parents and students and children in learning and discovering what potential dilemmas might be there. You're also going to want to be doing self-reflection on whether or not the actions that you are doing are effective as well as appropriate. Because ultimately, ethical practice is about protecting our clients while also maintaining our professional integrity. Just remember, with ethics, it's the backbone of our professional practice in terms of counseling and psychology, because more or less it goes beyond the law in us setting higher standards for ourselves for the profession. It helps guide us in decision-making frameworks as well as looking at complex cases. It's going to always have an emphasis in advocacy, responsibility, as well as that professional integrity. So as you're learning, you want to make sure you understand that you need to also include these ethical guidelines, not to be abstract rules, but as a practical tool, an arsenal, so to speak, that you have to develop and grow um, to help you professionally to be able to navigate these real world issues when you're helping children and their families. All right, let's talk about special considerations with children and adolescents. Understand, working with kids and teens is not the same as working with adults. Ethical principles, they really get trickier because you're not just dealing with one client. Instead, you're going to be balancing the needs and the rights of three groups at one time. Okay? And in that, we're looking at the primary client, who's the child. And then you have the parent who's the legally responsible person for the child. And then there's going to be the school or the agency that you might be employed with, or who's referred you for services. So they may have professional or institutional interests involved. What this does is create a triad, and triads often create conflicts. So the counselor or the psychologist's job is really going to be to protect the best interests of the child while also respecting the rights of the parents as well as informing and including the schools. Let's talk about client identification. This is when a child is considered the primary client. However, parents do have legal responsibility for minors, and they're also part of the client relationship. Schools or agency that may employ you are considered the professional stakeholder. Now, again, there's a three-way balance that you have to create where ethical decisions will definitely, not maybe, but will definitely require you to be able to negotiate how this is all handled. So you might see it as, say, for example, you're a school counselor and you want to protect a child's privacy, but you have to put the parents' wishes at heart in consideration because they might demand that they want full disclosure of what's going on in the therapy. Whereas the school, they might just want you to solve the issue quickly for that classroom behavior, help change it. So as you can see, there's different dynamics that are already developed, and we have to figure out how best to handle it. Sometimes that negotiating is tiptoeing, but you have to be able to approach it and solve the issues. One way of doing that is understanding child and parental rights. So let's talk about child rights first. Children have the right to understand the process and the results that's going to be given to them in an age-appropriate language. They're to know what kind of therapy is going to be used and why we might be using it with them. We need to be able to tell a child about confidentiality and its limitations on when we may and have to break it. And a child do have a right to say whether they want information shared. Now, I do recommend that when you're doing your intake and you're getting ready to work with a child, you really want to have all parties involved. So when you're explaining all this, parents get to hear and understand this process as well. Okay? Children should participate in that goal setting for their treatment and be treated with honesty and respect. It's not children should be seen and not heard type of environment. We definitely want to hear a child's thoughts and how we can be best serve them. Children also have the right to decline therapy if they feel it's not helping them, unless it's mandated by a court or individual education plan. Now, in terms of parental rights and their responsibilities, parents are legally to provide for their child's welfare. They should have access to information that affects their child's well-being. They should be seeking out therapy for their child if they consider it's needed or necessary. To be involved in goal setting as well as the treatment decisions. Parents should be given the consent for treatment and then information to be released. So realize there's an overlap here. Parents have the legal rights, but children should have ethical rights. And you as a counselor need to know how to balance both. Knowing how to be able to prioritize all of this with the child's best interests in mind. Now, there's no black and white here. Ethics is gray at most. So let's look at some of the gray areas. There's that consent versus assent. Now, parents are going to give you the legal consent because, again, they're responsible for a child's well-being. But you still should be seeking a child's voluntary assent to participate in this process. Because if they don't want to, then it's really no sense of them coming in. However, you do have those conflicting goals. Because parents may want the therapist to fix a child's behavior that the child might not even see as a problem. You again need to balance it out and be able to discuss those dynamics. Sometimes when you have a child that's identified as the patient, that label becomes problematic in itself and creates deeper issues within the family dysfunction. So ethically, as a counselor, you should be addressing the family system rather than just unfairly scapegoating the child. Then we have documentation. We got to look at that in the process because that labeling a child as disordered for insurance purposes actually can be harmful to that child later on. It can create stigmas because this often gets found in school records, and it might inhibit their, post-education. So one way of seeing it is, of course, I'm going to give you another example, is taking a look at a teenager who might have been brought in for counseling because they're considered rebellious. Now, during counseling, it becomes clear that the real issue is an ongoing conflict between the client and the parents. Now, the ethical counselor advocates for family therapy, not just treating the child as the problem itself. So some things you're going to want to take away from this particular area is that when we're working with children and adolescents, ethical practice requires one, advocacy. You're always going to be there for that child welfare. It's our top priority. Clarification or clarity. Again, we need to explain confidentiality, explain child and parents' rights, and the limitations to both children and parents. Provide balance. Again, we want to respect the parental legal authority while we still want to empower the child's voice in this whole matter. One thing I hadn't mentioned, but we need to consider, are cultural and developmental sensitivities. We need to take time to think about a child's age, their maturity levels, family context, where they found in the family, as well as their cultural background, because that will impact how treatment will go too. In terms of ethical decision making in child and adolescence counseling, you got to know that it's more about following a formula that's not rigid. You got to be flexible. It's about being able to navigate those gray zones that I mentioned while also protecting that vulnerable client that you have. So we also have to consider legalities when we're talking about ethics. So the legal and ethical overlap in terms of child and adolescents mental health services would be how we go about working with children and adolescents as a mental health professional. Know that we have to juggle both those ethical principles, what we consider to be right and professional, to the legal requirements, those things that's required by law. Now, usually if there's a law, really there's not a big question to it. You have to follow it. But, and I say but, many situations again will fall into that gray area where ethics and law will overlap or might bang heads or clash with one another. Now, because our society is increasingly going toward legalities and wanting to sue, more people take issues to court. Courts are making more decisions about things like parental rights and the notifications, school policies and procedures. They're also using the use of medications in schools. Then you have school safety as well as violence issues that the courts might be involved with, as well as looking at what it means for counselors or psychologists, as well as other providers needing to stay up to date with state and federal laws, and how recent court cases may shape what we can do or cannot do in terms of our ethics and following the law. Now, in this, you also want to understand that part of the licensing process, jurisprudence, is those laws that we're talking about. And the American Psychological Association, for example, many of our licensing boards expect you to know those laws, and they'll test you on it when it's time for licensure. Anyway, there's three key legal areas in counseling that you need to stay abreast of. The first one is confidentiality versus privileged communication. Now, there's oftentimes we confuse this, but there's some differences involved, okay? So when we're talking about confidentiality, here we're looking at a broad duty to keep client information private, and it's covering what happens in daily practice that's outside of a courtroom. So, an example might be a counselor doesn't share details of a student's therapy session with teachers or peers without permission. Whereas when we're talking about privileged communication, this is more narrow, and it's a legal rule that applies specifically inside the courtroom or inside court. Now, what this does is protect clients from having their private information revealed during legal proceedings. An example of this would be, suppose a case would go to court and there's certain therapy conversations that may be legally protected from disclosure, but not always, okay? Think of it like this. With confidentiality, it's the ethical promise, whereas privilege is the courtroom shield, okay? The second thing we have to consider, requirements for confidentiality to count legally. Well, here we're talking about how for information to be considered confidential and potentially privileged, there's 4 conditions that have to be met. The first one is communication is with a licensed certified therapist or counselor, that there's a professional relationship that exists, not just somebody casually talking to a counselor. No, they have to have been hired to be your counselor or therapist. Third thing would be information about the professional services, like the therapy, the assessment process, that needs to be present, as well as communication is private and not already shared with others. If it's been made known that client's information is already out there without the use of the counselor, then it becomes open season, okay? Now, the third thing we have to consider is that not every state has the same laws in place, right? So we have to go by state differences. There'll be some states that allow broad privilege for psychologists or counselor-client communication, whereas others may be more restrictive, and it'll be more in terms of specific areas, like substance abuse counseling, for example. Privilege rights often belong to the client, not the psychologist, okay? So when you're going into court, you're not protecting yourself as a counselor, you're protecting the rights of your client. In terms of children, because they're minors, then they are legally considered incompetent to be able to exercise privilege. In that case, parents usually hold the legal right to waive or enforce situations as far as in treatment. Professionals with multiple licenses, like say for example, you might have a private practice and you're also teaching in schools as a school psychologist or counselor, you might have different issues going on in terms of privilege rules depending on what setting you're in. So that's something you have to be aware of and get an understanding of that particular state's jurisprudence in terms of being in those different roles. Now, with everything we have complications, right? So here let's look at children's rights versus parents' rights again. In this realm, ethically speaking, children deserve the same confidentiality protections just like the adults. Legally speaking, parents generally have the right to assess their child's records and control the services at hand. Now, of course, you know this is going to create a conflict in tension, right? Because a counselor might promise confidentiality to a child, but the law may still allow parents to access the records because what? They're responsible for the child's welfare. All right, so let me put this in a picture that hopefully will make this all make sense. A 15-year-old confides in a school counselor about being depressed. Ethically, the counselor wants to protect that privacy. Legally, the parent may have the right to review the counselor's notes. So therefore, the parents will find out about the child's depression, depending on what's written in the notes. All right, so on that note, let's just talk about harm or duty to warn. So I'm going to talk a little bit about the duty to warn principle. Sometimes when we're treating a client might reveal plans to hurt someone or themselves, right? These are one of those situations in which the counselor or the therapist cannot keep everything confidential. These are one of those limitations, and this is something you definitely want to share at the very beginning of treatment. And this is where the duty to warn definitely comes into play. More or less, it means that the professional has a legal and ethical responsibility, as well as, let me say, for children, an obligation to take action to protect people from serious harm. So there's three things that you're going to be doing. The first one would be notify potential victims. So if a client makes a credible threat against a specific person or group, then that counselor or therapist may have to actually go about warning that person if they got a name, or they say, for example, a school, or unfortunately once again had a shooting, active shooters. If that person had went to a therapist first and said that they were going to Annunciation and going to shoot children during that mass, then it would have been the responsibility of that counselor to contact them in advance, as far as in advance that they could. So again, it's them planning an attack and the counselor having that duty to warn that classmate or the school in this case, so that children would have been protected. And that's only in the case of where someone was actually told about it. Okay. The second thing you're going to have to do, not only call up ahead and call the school and let them know what has been told to you, but a lot of times the therapist or counselor must also call the police or any other law enforcement agency. This step helps to make sure there's an official action taken to keep people safe. So again, the client would share a plan that they're going to hurt these children, and you as a counselor now calls the local law enforcement so that they can intervene and hopefully stop it from happening. Third things would be to try to take steps to prevent threat and danger. Beyond giving warning, counselors or therapists really should take reasonable, and I say reasonable steps to try to reduce the danger. This might include hospitalization. If the client appears to be a danger to themselves or others, you might have to have a 72-hour hold put on that person to kind of help save themselves or save other people. You want to try to work with family members to be able to increase supervision and safety for that person to help along the way. So another way, now we're talking about homicidal behaviors or ideations, but what about suicidal? If there's a client that's suicidal, Then again, the counselor might have to call emergency services, involve the family, as well as arrange for crisis care to keep that person safe from themselves. So understand confidentiality, there are limitations, but overall, protecting life and safety will always come first. Duty to warn is about balancing the client's privacy with the safety of others. Now, the exact legal requirements again vary state to state, but there's one principle that's rooted, and it's based upon a case that's from California, the Tarasoff versus Regents of the University of California. This was back in 1976, and it was this case that which established that protecting potential victims is more important than absolute confidentiality. Because in that case, the counselor and therapist stayed quiet, and unfortunately, there was harm done. So it was because of that case that we now made sure we opened up ethically to ensure that we are putting our clients first, putting people first, before the confidentiality if it looks like someone's going to be a danger to themselves or others. Finally, just want to remind you about informed consent. There's going to be receipt of specific permissions to be able to have, a complete explanation of the nature, the purpose, as well as potential risk involved. And then again, you got to remember consent versus consent implied in terms of the law. So remember now, we get a child's assent, and it's going to be the parents' permission. And because the parents are legally responsible, the court will always probably lean on the way of the parents' rights to being able to access and getting disclosure of information about that child. So privilege kind of gets murky in that sense. Anyway, that's just some legal issues that you have to remember and keep in mind. All right, so we are close to coming to the end of pertinent issues that I wanted to point out in chapter 2. And we're going to talk about FERPA and what all that fun stuff means in terms of access to your records. So what is FERPA anyway? FERPA stands for Family Educational Rights and Privacy Act that was created in 1974. This is a federal law that protects the privacy of student education records. Parents and students, once they turn 18, have the right to access these records and request corrections if the information is inaccurate. Now, schools must get written consent before releasing any student records unless certain exceptions apply, like safety emergencies, for example. Now, so here's a situation. A parent asks to see their child's school counseling notes. Now, depending on how those notes are stored, they may be considered part of the child's educational record under FERPA. So that means that they probably get a right to see it, right? Now, there is a case, Page versus Rotterdam Mohansen in the Central School District back in 1982. In this particular case, the court reinforced that school records, including counselor notes, may be covered under FERPA. The case highlighted how privacy and access rights really intersected with one another. Parents and guardians generally have the right to access records, but counselors also have an ethical duty to protect sensitive information. And it's this that will create tension between protecting student confidentiality and following the law. So school counselors in this sense got to be really careful about how they would document therapy notes, progress monitoring, as well as other records since this may be legally accessible. Then we have to talk about school-based interventions. So when treatment happens, counseling happens in schools, then the ethical issues become layered. And this is because the client may be a student or the parents and guardians and or the school district as the employer. It can also mean confidentiality can get complicated. School counselors must balance again and negotiate protecting the student's privacy with legal obligations to parents and the school. Then you have what we call progress monitoring. Here we're talking about how schools will often require progress data for academic and behavioral interventions, like an IEP protocol. Counselors must record enough information to track progress without disclosing unnecessary sensitive details. Like, for example, say you're talking to an adolescent and that adolescent shared with you some particular details about activities that they performed. Would you put word for word what the client said, or would you give a synopsis enough for there to be an understanding of what transpired during the session, but not the exact wording? There you are still following the rules and you're doing what you're supposed to, but you're also protecting your client. So that example here, this would probably be helpful to know. Instead of writing student cried because of family conflict, the counselor might document instead student engaged in emotional regulation strategies for 15 minutes during a session. Here we're saying what we went through, what was dealt with, but we didn't go word for word. You see the difference? So it's all how you will formulate your terms when you're writing your notes, because you don't want to omit things purposely, but you want to protect your client. So by saying you discussed emotional regulation strategies, you still talked about the things that we covered, but you just didn't give specifics. Now, when we're talking about group therapy in schools, here you're really going to be challenged when it comes to confidentiality, because group counseling is really common in schools. You might have a social skills group, grief groups, performance groups. There's all different type of group dynamics that can be done. So that's when it's even harder to maintain confidentiality because multiple students are going to be present. And unlike individual counseling, the counselor cannot fully guarantee that students will keep what's shared private. In this instance, think of it like this. A student shares about being bullied in a group session. Then there's another student in the group that might talk about it outside the session. Hence, it broke confidentiality. But the counselor, there's no way to force all members to maintain confidentiality. Privileged communication in groups. There are communication laws, which would be a form of protection in court, but it doesn't always extend legally in group settings. So, for example, courts may not consider group therapy conversations as fully privileged in the first place, since there's more than one person involved. Counselors must provide clarification and give this limit of confidentiality at the very start of therapy or counseling services. Now, when we're talking about confidentiality, why is it crucial for group counseling? Just like in individual counseling, students will need to feel safe to be able to disclose and open up. When there's a breach of confidentiality, it's going to damage trust and it's going to be harmful and detrimental to the student's mental health. In this particular case, you need to be able to explain the importance of privacy to the group. Create boundaries and create ground rules. Let them know what the expectation's going to be. That what's shared in the group stays in the group. You want to be able to also remind students of those limits to confidentiality, particularly when we're talking about safety concerns or other legal obligations. Those are just tip of the iceberg type things that we have to consider and remember, but they are always going to be present. All right, well, we are at the end of chapter 2. Quick and easy and simplified? Not. But hopefully you'll understand the concepts that's behind the ethical issues that's involved. There will be a reflection paper, just like last week, in which you will complete the reflection paper and submit that in Moodle. And if there's any questions, please send them. And I thank you again for listening. See you next week.